When do you think is the optimal time that a urologist should be sending their patients to see a patient with castration-resistant prostate cancer?
Well, I think in terms of timing for referral to a medical oncologist is really when you feel a patient needs chemotherapy. And I think obviously that comes with experience, and obviously the best setting for a patient is in a multidisciplinary team. However, saying all that, typically when a patient starts to fail the novel androgen axis inhibitors, if they're given first line, or what we used to call pre-chemo, usually you get a PSA rise in a very asymptomatic patient. That might be the ideal time to consider a referral. I think one of the situations we want to avoid is a patient getting so sick when they're failing the novel androgen axis inhibitor that they almost lose the ability to get chemotherapy. So you want to typically get that patient to the chemotherapist before that happens. Now, if you look at the pivotal trials on this question, that's on average about 24 months. And I think what's important about that is to understand the urologist is not going to just have these patients in their practice for 3, 4, or 5 months. But if you look at the data, it's probably going to be a good 18, 24 months before the patient actually requires chemotherapy. So it is a bit of a longer term relationship, and it's not like we're embracing it just to embrace it. It's going to be a considerable amount of time in the urologist clinic.